There are two regions of the pregnant body that I like women to work on their strength on throughout pregnancy. It's the mid-back and the pelvic region. And the reason why is for both pregnancy and postpartum. So during pregnancy, our core gets a little bit weaker. We tend to slouch a little bit more. It's hard to keep engagement and good posture. So if we keep our mid-back strong, it's going to help posturally. For our pelvis, it's really an area that there's a lot of laxity that can happen and a lot of discomfort for a lot of women in their hips. So if we maintain strength around that area, we are going to decrease the amount of discomfort that we have. Now, postpartum, we are rounded around a baby. We are seated all the time. So our glutes get weak, our posture gets poor. So if we can keep the strength in our mid-back, it helps with posture postpartum. If we can keep the strength in our glutes, it helps not only with just having more stability of our pelvis, but having glute strength helps with decreasing low back pain. So I like women to go into postpartum with a mid-back that is strong and with glutes and a pelvic region that's strong. So there's a couple movements for each that I'm going to demonstrate briefly to show you what I would love you to work on during pregnancy. So one is going to be a row where you can do a staggered stance. And the entire time you do these movements, you want to think about core engagement. I do have some videos that are called Exhale, Engage on Exertion. I have ones that are deep core engagement during pregnancy. So watching those can be helpful to know how to perform movements. So I will talk about them briefly here. So I'm going to do a hinge in my hip, and I'm going to think about my lower belly lifting when I'm engaging. So I'm thinking about pubic bone pulling up to my belly button. I'm not just pulling belly button to spine and gripping. It's just a slight lift of my lower belly. So for a row, you can do dumbbells or kettlebells, and I'm going to bring my elbow up nice and along my side and slowly back down. It's going to be a slow raise and a slow lower. And again, my lower belly is scooped up to work on that core stabilization. There's other ways to do rows, but that's one demonstration. Back flies are another great movement. So taking some lighter dumbbells, you can do that staggered stance, or you can do a wider kind of hip hinge movement and come out like this. Staggered stance, I find more balance in, and you're just bringing your arms up and out to the side. Slowly back down, thinking about maintaining that core engagement as you're in this position, and slowly lowering down. Perfect. So we have rows, back flies. Now for the lower body, I have another video that talks about good mornings. So you can do a good morning. Watch that video for more instructions where you hinge back, drive those glutes and lower belly and scoop up. Good mornings are great. A similar movement to good mornings, but we're going to add a weight to, and you're pulling the weight from the ground as opposed to lowering from the top with a good morning, is I'm going to hinge down and then pick up the weight as I pull up. So with this, when I'm lifting the weight, I'm engaging my core. So watching those videos to help support this deep core engagement videos will be helpful. So I'm going to scoop my lower belly as I engage my glutes. So deadlift here, engage on the rise. So good mornings and deadlifts are a hip hinge, which is a great movement to learn if you don't know it. And now we're going to review a squat. So I like goblet squats where you can hold the weight up near your chest. I'm going to do a wide stance, and I'm going to squat down, drive my glutes up. I'm going to engage my lower belly and my pelvic floor with a slight lift as I drive up. So I'm going to inhale down, exhale, engage my deep core. So the two main areas to work on, you don't have to just do these movements. These are just a few examples, but the mid-back strength and the pelvic strength are the two areas that are great to work on throughout pregnancy with your strength so that you can help yourself postpartum.